about 11 days, I think it says. 11 days after he recorded it, he died, and he was 50 years old, married, father of six, and he died from COVID-19. So that just very shows very much that we ourselves can hurt others.
Hey everybody, welcome to our another one of our podcast little videos. I'll be hosting today and we'll be talking about race equity. So this is everybody. Say hi y'all.
What's
Period.
good?
Okay, so let's just get into it. So lately on social media, I've been seeing like different things talking about like low income communities being affected by the coronavirus in like faster rates. And then meanwhile, you see like these celebrities and things like that and how they're just chilling, they're cooled down. They're not really saying anything about coronavirus other than like, oh, be safe and things like that. Like obviously, but they're just chilling in their big mansions. Like what's going on?
It's pretty unfair. People are struggling in poverty, and minorities are hitting harder, or being hit harder than the rich people. And then they're on social media and stuff talking about it. But I don't really see anybody like trying to go out their way and help the people in need. The minorities and the communities that are being hit like hard with this new corona outbreak.
For me, I guess it's like really aggravating to see celebrities like still going like on trips and being around people and not social distancing. Like if you're a celebrity and you're living in your mansion, that's fine, whatever. If you're being safe about it, that's okay. But if you're putting other people at risk and you're being selfish, I think you're using your privilege in the wrong way when you could be using your privilege to help lower income families and just spread the word. So I think like they have so much influence in society that I think a lot of celebrities are like using that wrong. So I guess that's the only thing that bothers me.
It's funny how people say stay home, stay safe, and then they all just end up going out of their homes. They're in places that they might not necessarily be populated, but for sure there's gonna be people there, and it's kind of like hypocritical to be like, don't do this, but do it. They're doing it themselves.
Well, do you guys think that there are specific races being targeted by like this whole thing going on? Like, are there any specific racial groups that are being targeted by this and are affected more?
Well, a virus technically can't be discriminated, but
Right.
I feel like it's attacking more people that are in the poverty communities, and which are populated more by the African American community and Latino community mostly, and then there's other races involved too, but it's mostly those two races that are hit hard. But technically, a virus can't be discriminated, but it's showing that in the data that they are hit the hardest. So I guess it is low key targeting races and people.
Yeah, like DeAndre was saying, I think it does have to do with like factors of where you're living, access to healthcare, and obviously if you're lower income, like it's going to be harder to get treatment, or you don't have as much access to things to maybe prevent yourself from getting the virus. And like he was saying, the majority of the people that are living in poverty and are lower income are African Americans and Hispanic Latinos, which is very unfortunate.
Yeah, the fear of not being able to have enough money, especially for the low income, they feel like they're forced to work, and with that pressure of worrying about, oh, there's a virus, plus I have to take care of myself. But what is more important is what they prioritize. Well, they have to like not succeed another day, but live like another day, have food on the table, do what they can to keep where they live, because they're worried that they will not be able to have like enough to survive another week or another month, depending on their situation.
Yeah, I think like the lower like class communities, kind of like DeAndre was saying, are being targeted more because they don't have as many benefits or as many opportunities that people with money do when it comes to medical things. So they can't really go get checked up, or they can't really do too much to keep themselves safe from the virus.
I was watching the news this morning and last night. So there was I forgot what state was it, that they said that they were gonna open like movie theaters, pools. They're gonna open all the stores, which is really not smart, because if people start going out and everything, start being around like big groups and everything, like people are more likely to get the coronavirus and not do something more stronger, and that could actually, like not really be treated. I'm pretty sure it was like Texas or something like that. I think it's Texas, but I don't know.
I think there was one in California. There was a situation on Twitter that I seen. It was like Huntington Beach.
Oh, the protest.
Oh yeah, they're on the beach
Yeah,
or
yes.
something.
There was so many people.
Exactly. Like, do you guys think it's safe for people to be protesting right now? Because personally, I don't think so. It's not really. I don't think it's effective, especially since we're supposed to be inside and it's quarantine. Like, you're trying to spread all that. But I can see where they're coming from, because these are people who lost their jobs during this time, and they have to find a way to like try to like find help for their families and things like that. So it's kind of like, I see both sides.
Mm-hmm.
I understand the idea of wanting to protest, like maybe the closure of maybe small businesses. That makes sense. But if you're protesting the fact that you have to stay home, and like, because they're protesting the whole thing, they think it's like a government scam, which is like a whole different topic. But I think protesting is great. It's great if you do it right. And I don't think they're being safe about it, and they're putting at risk people who are underprivileged and don't have access to healthcare and to stay safe. So if you're out and about protesting about the virus, spreading it even more, like, what about the people who don't have healthcare or health insurance? What are they supposed to do just because you were being selfish about things? Like, do it right if you're gonna do it.
Yeah.
I actually saw like a tweet of data saying that the people who are like protesting, like they're like either voting for Trump or they're a Republican. Like, I was like, what? I was like, that doesn't really make sense.
Right.
I think, like we were saying, like comparing like the statistics of the majority of lower income, like it's obviously affecting access to health care and stuff. So yeah, I think that like race does have a lot to do with it, whether it be like racist like things where like if you are a certain race, you don't have as much opportunities for better paying jobs. If you don't have a good paying job, you are more like or less likely to have good health insurance. No health insurance or bad health insurance, you aren't very, like, you're more prone to diseases or viruses in this case. So yeah, I think your race, your ethnic background, etc., where you live, just your like living conditions do affect like things like this.
I totally agree.
I think that if more people know about race equity, we'll be able to like fix a lot of the problems that are going on, and like it could really change the future ahead of us and things like that. So I guess, do you guys think that history has something to do with race equity and like how things are happening right now?
Most definitely.
Right.
Maybe as in history, like what are you referring to as in history? Like, what is history?
American history, like
So like discrimination.
Yeah.
Okay. I mean, yeah, that could also tie in with the situation that people are having right now. I guess that could tie in. I guess yeah, discrimination. Cause like the what's it called? The China situation with the Africans from I forgot where they came from, and China, the citizens of China, like they banished them, not banished, but they banned them from
Right.
entering places because they thought that they had it already locked down, they had everything locked down, everything was safe, and the foreigners, Africans that were coming, like that were there, bring it back. Like I don't understand that. And then they were like sleeping on the streets. People couldn't go back home, or people were trying to eat, but they couldn't. It was just I can't believe it. Chaos. Why would you even do that?
Right. Like, why are you kicking out people who have nothing to do with that all, and then they're trying to put the blame onto them? Like, they're just, some of them, they've been citizens for a while, and some of them, they're just there to like visit, and you're kicking them out of their homes that they should feel comfortable in, and then now a lot of them being homeless. Like, it just doesn't make sense to me.
Yeah. Mm-hmm.
A lot of fears from what it seems like. Sometimes, well, maybe not sometimes, but for that case, it makes seem like discrimination is happening with the fear of like, oh, don't come near me because if some of you guys brought it, you could say it's like a stereotype, not because it for sure happens here in the United States. There are plenty of videos like with Asian people.
Yeah.
There was this one video that went like, I think it went viral. If not, then I just saw it somewhere else on the internet about just like they were on a train, and this man was just recording this female Asian, and I don't think she ever coughed, but like if she did, she went like or something, and then the person was starting to get like more aggressive and be like, get away from me, stop coughing, or cover your mouth, like very like loudly and more aggressive each time. And it's just that fear that there's a lot that contributes to fear that brings other people worry, and with that worry it becomes discrimination against everybody, not just a certain person. And it consistently happens throughout history. It's been shown many times.
I've seen a lot of that discrimination, and people like Asian people, to be exact, are perceived as virus hosts and stuff like that. It's disgusting.
Right.
Seen a lot on it, especially I think it's more like active over in America. People are discriminating against the Asian community.
Mm-hmm.
I remember like when the coronavirus first like happened, that like people that was making just videos, like very racist videos, like about China and everything, that they're posting on TikTok. And I remember on Twitter that there was an Asian man, like he walked into a store, and then there was a Caucasian person there also. So when the Asian man was trying to buy, like I think it was like water for his kids, but then the Caucasian man wouldn't let him go into the store because he was Asian. Yeah. And then yeah, I was like that's like horrible. And then his kids were crying in the car, and then the white dude called the cops on the Asian dude, tried to get water for his kids.
That is so bad.
I know.
It's crazy because I saw a video like earlier when this whole thing started, and it was like this one, I don't know if it was an Asian student or something, but I know it was a person of Asian heritage who was getting jumped on the subway, and I just felt so bad because like unless if that was from like months ago, but either way, like why are people getting discriminated against over something that has nothing to do with them? Like you shouldn't generalize it over the whole race. They're humans too. Like we're all human. Like there shouldn't be anything that's going on like that.
Yeah, and that's like that reminded me of the president, Trump. He said the China virus. And that was pretty bad. I don't know why do you call it the China virus, or Chinese virus to be exact. I think it was called the Chinese virus. He said that. That's pretty.
Right.
I mean, I know it like probably curated. It was not created, but it was found in China. But you don't have to go to the lengths of saying, oh, it's the Chinese virus. They are the people at bay for this whole thing. Like, no.
It's not like the whole country had an involvement in it. It was literally in one specific city. Like,
Yeah.
I can't say the city's name, so I'm not even gonna try to butcher it. But
To me, it's so sad. But like at the same time, I'm not surprised that this is like the way the world has decided to react, because racism has existed for like so long, and it's so disheartening and so sad and disappointing to see that we are in 2020 and things like this are still happening. Like, what?
Yeah.
Like, like it seems like it's only getting worse. But I'm hoping I'm wrong. I'm hoping I'm just being like pessimistic. But we, as a society, like, we let things like race, ethnicity, cultural backgrounds define situations like these, which shouldn't, because we shouldn't be going against each other. We shouldn't be discriminating others because of where they come from or what they look like. We should be standing together and fighting this whole thing by like listening to the scientists and helping out our communities safely, and instead of hating each other and putting the blame on a specific group of people.
Mm-hmm.
Do you guys think that people that look at the statistics and see that it's going down, do you think that they see, oh, it's going down, the situation is getting better, it's okay to go outside now, and that's why they end up going outside even more, or they want to be outside more because they see the numbers go down?
I think that plays a role in people deciding to go outside and do what they so please. I think people will look at the statistics and decide on that.
I feel like people just look at what they want to see and not the cold truth about, even though the numbers are going down, it doesn't mean it's safe.
Yeah, they haven't canceled quarantine. That doesn't mean you can go outside because numbers are going down in your area.
Yeah, but like the reason why a lot of people think that it's okay to go outside, because if you guys have been like on TikTok or like been on YouTube or something like that, the Venice canals, like the water is clear, like it's like no pollution, no nothing in it. And now like there's jellyfish and dolphins now in the canals, and it's been 60 plus years that no dolphins or canals actually, or no dolphins and jellyfish that have been in the canals. It's been like over 60 years. So, and there was a veteran, a World War II veteran, like he beat the coronavirus, and then like a lot of people, they're like, oh yeah, see, the coronavirus is not really nothing, blah blah blah, which is still horrible because it was just that one man that beat it, but there's still hundreds and thousands of cases that they still have the coronavirus, and there's still hundreds of thousands of people that will die from coronavirus.
Yeah, I get what you're saying. People aren't intimidated about the virus.
Yeah. I don't know if that's still going on, about people thinking it's just the flu. It's just like another flu, which actually has been proven wrong. I think like the rate of spread rate is like 0.8% much higher. So, and then it kills much more. Like on average, the flu kills around 60,000 people a year. And people that were saying it's like a flu, well, it hasn't even been a year yet, and it's already killed more than 60,000. That was like within like 3 months of the virus starting. And it just goes back to thinking it's comparing to something that it's already common and just hoping or wanting it to be like that. And it I guess you could say it just like worries you less if you see it that way, and it's not good to not accept what it is when the evidence is clear.
I think another reason why people are like starting to go out again is because they're acting out of fear, I guess. Because we didn't get affected at first, like instantly, I guess. So it didn't hit us as much as it hit other countries. And now that it is affecting us, as soon as we see things getting better, we act on impulse and want to take advantage of that because we think that it's not going to come back in a long time. So now that we have it, we're just like, oh, okay, we got to take advantage of it. But in reality, we're putting ourselves in more danger because it's not 100% safe.
Right. I think the reason why people are kind of going out more is because they're desperate to go out. Like, they don't want to be in the house anymore. Like, I know I don't want to be in the house anymore, but I'm not. And plus, personally, I'm not scared of the coronavirus, believe it or not. I just think that if you do the right things and you stay away from the certain things that like cause it and like people who have it, then I think you'll be fine. But I'm not gonna go out of my way to purposely go outside in like hundreds of crowds with people, knowing very well if there's not flu, but a virus going around. So it's just people just being, I don't want to say selfish, but yeah, they are being a bit selfish. Like, just stay at home. You're gonna be just fine. Just saying.
I don't know if it made sense. I'm gonna try to make sense of this third time in the charm, guys. Well, basically, the Latino community, they have, it's more common for them to be diabetic and things like that, which is a problem, especially with this virus, because the two together is a terrible combo for your life. And since it's more common within the Latino community, it's something we should probably be looking out for, see what we can do to help or bring awareness to that, because people with those types of things are the ones even more in danger compared to somebody who's in perfectly fine condition. People with asthma, anybody with asthma, they don't have a very good chance of surviving. And it's those people that sometimes we might need to take care more of than just a perfectly fine person, because the odds are different, and it's about thinking about the other person sometimes more than yourself, and what can we do to help, or what can they do, what should we say or promote, or things like that, because it's the ones that are already affected by something that with this is just going to make it even worse. This virus is just not helping people who are already affected, and it's making their lives much more difficult.
Yeah, I'm gonna go a little bit off track, but my mom, she's a medical assistant. So I remember in the beginning they said Trump said that it's not like an airborne type of virus, and then my mom, she had a patient that they had the coronavirus, but he's a cop. But the thing is that the person who gave him the coronavirus was not near him at all. So the cop that who had it was taking a night shift, and then that's when he said that he didn't feel good, so that he just went to the hospital, then went home, and then the next day, that's when the cop that my mom was seeing, the patient, was literally like 2 days later, that's when he went back to work, and then that's when he went home to his wife and kid, and then his son has asthma. So basically what my mom needed to do was prescribe him all of his medications and everything, and to make the mom and the son not to be around the dad too much, because since he has it, and the son was only, I think, 7. He's only 7 years old, and yeah, it was really sad. And then his son his asthma is I think they say it's a chronic asthma, something like that. That like anything can trigger it like very, very easily. So which is really sad. And then my mom also had another patient that the mother had a son who was only 12 years old that had asthma, and then he was around a friend who had the coronavirus, and then he passed away because the other kid had the coronavirus and he didn't know.
Yeah, that's unfortunate.
Yeah.
something that ties into that is miscommunication about the virus and the symptoms, lack of correct information. That could be deadly in many cases if you're not properly educated, if you are not aware of what to look for, and you can be a great danger. And I think something that, like, obviously lower income communities, they may not be getting the correct information or as much information as they need. So I think really raising awareness about spreading communication to those communities and like the right information so they can stay safe in any way that they can is like really important.
Oh, another thing that I want to put out there is that Trump needs to provide more for the nurses, doctors, and medical assistants. Like, he needs to provide more for them, because the doctors, they're trying to treat patients with the coronavirus or without it, but it's still very, very dangerous for the doctors and stuff.
It's crazy. I do think that the Trump administration definitely needs to, not even just them, I think that both the Republicans and Democrats need to come together as one and like not think about all this election stuff.
Yes.
And they need to push that aside for now, and they need to worry about the things that are going on in the country. Because why are you still worried about an election that is nowhere near right now? I don't think so. I'm not really a politics person, but why are you focusing on something that is not even that close? Compared to the virus, we need to worry about that first. And another thing is, I feel that like the health industry and things like that, they need to really put like rules and precautions when it comes to like cleaning the areas that they're in. Because, for example, my mom, she works at like a nurse center or things like that with like the elderly and stuff, and there's this like housekeeping job that like some people will have to do, and they're not doing it correctly. So a lot of the stuff that is probably like infected with the virus, and they're not doing their job. And it's like, how are they supposed to work in an environment that is, you know, surrounded with the virus? Is not good. You need to like do something about it. Like, and nobody's saying anything really. At least they're complaining, but nobody's taking the time to tell them like, oh, you need to do this or you're going to get fired, because they have to do their jobs, you know.
Did you guys hear about that one story about the bus driver who died?
I don't think so, no.
How did he die?
March. So basically, you want me to read the quote he said?
Sure.
I got you. I pulled up. It says, "We're out here as public workers doing our job, trying to make an honest living to take care of our families. But for you to get on the bus and stand on the bus and cough several times without covering up your mouth, and you know that we're in the middle of a pandemic, that lets me know that some folks don't care." So the story was a woman, I believe it was a woman, got on the bus and was just coughing several times without covering her mouth. And it was pretty much, you know, I think he knew. He went on Facebook and posted it, and it blew up like quick because it was just something crazy that was happening at the time. And he was basically on a rant and just expressing himself that people need to take it seriously. Like I just said, he said about honest living for our family, like trying to make money to survive. And so since he's a public worker, he's forced to work, and his situation, he can't really do much about it. He can't really kick anybody off the bus or anything because that's not in his power. So like you guys were saying earlier about the homes, how they have to do that, how they have to do their job. It relates everywhere, and if people don't take this seriously, people could die. So after he posted this, about 11 days, I think it says, 11 days after he recorded it, he died. And he was 50 years old, married, father of 6, and he died from COVID-19.
Wow.
So that just shows very much that we ourselves can hurt others. And I think a family of 6 is a lot. That's 8 people in total plus 6.
And like you see how like people want to go outside, like you know all the stuff stories that actually happened, and people still want to go out and stuff.